Hi guys, welcome to today's session, and today we are going to discuss about One Health concept. And in this session we'll first see the background of One Health approach, and then we'll discuss few points on India and One Health approach, and then we'll discuss pandemics like Covid-19 and One Health approach, and finally we'll discuss potential outcomes from the One Health approach. So that's how I plan this session. Let's now start. So One Health concept is being recognized as an effective way to fight health issues at the human-animal environment interface, including zoonotic diseases, and it was proposed as a concept to foster such interdisciplinary collaboration. It is adopted by international agencies charged with the control of zoonotic diseases, and zoonotic diseases are basically that diseases spread between animals and humans, such as flu, rabies, etc. And this concept is used by Food and Agriculture Organization, World Health Organization, and the World Organization for Animal Health, etc. And in India, it is a component under our National Mission on Biodiversity and Human Well-being. So that is background information about the One Health concept. We'll now see what is exactly the definition of the One Health concept. So One Health concept, as we discussed, it is a worldwide strategy for expanding interdisciplinary collaborations and communications in all aspects of healthcare for people, animals, and the environment. And this approach identifies that zoonotic diseases, environmental pressures, food security, antimicrobial resistance, and health threats of animals and humans are all interrelated. It recognizes that a standalone approach will not work, and that the health of people is closely connected to the health of animals and our shared environment. And recently, to deal with zoonotic diseases, a need to operationalize One Health policy in India was highlighted, and the diseases which spill over from animals to human, that is basically the zoonotic diseases, and these zoonotic diseases represent more than 60% of emerging infectious diseases worldwide. And destruction of natural environment, globalized trade and travel, and industrialized the food production systems have created numerous pathways for new pathogens to jump between animals and human. So there is a rise in zoonotic diseases all around. Although One Health concept as a conceptual entity emerged relatively recent, a stellar example of One Health being operationalized in the field was seen in India in late 1950s. And presently India is dealing with the coronavirus, and the virus appeared to have its origin in bats. However, there is no conclusive evidence in that. So it is a pretty relevant topic when dealing with coronavirus. India adopts this One Health approach, and as we said, it is an approach to designing and implementing programs, policies, legislation, and research in which multiple sectors communicate and work together to achieve better public health outcomes. And the areas of work in which a One Health approach is particularly relevant include food safety and the control of zoonotic diseases, and also combating antibiotic resistance, that is when bacteria change after being exposed to antibiotics and become more difficult to treat. So this is the basic definition and basic idea behind One Health concept. Now we'll discuss India and One Health approach. Like we discussed, in the 1950s, One Health approach helped discover the source of Kaiser forest disease, KFD, a highly dangerous hemorrhagic fever, more threatening than COVID-19. So India dealt with KFD by this One Health approach. This was a result of working of several organizations such as Virus Research Center, now known as National Institute of Virology, which is in Pune, and the World Health Organization was also a part, and also the Bombay Natural History Society was also a part in dealing with KFD. And in 2018, Kerala reacted quickly and efficiently to tackle Nipah virus outbreak, and successfully managed to confine the death number into 23 cases. So this was also as a result of One Health approach, and this success is credited to the strong public health infrastructure and the political will to quickly seek help from a multidisciplinary team of national and international experts. And one of the components of National Mission on Biodiversity and Human Well-being explicitly link biodiversity to human health through the One Health framework. We discussed it already, and however, the regulatory framework for doing One Health research in India with international collaboration typically requires approvals from multiple authorities. So that is a headache, and this hampers countries' ability to rapidly respond to emerging threats from infectious diseases. So that is India and One Health approach. Now we'll discuss pandemics like Covid-19 and One-Health approach. When dealing with a pandemic like Covid-19, the need for greater interdisciplinary collaboration was identified with the emergence of zoonotic viruses with pandemic disease causing potential in every years of 21st century, and changes in land use patterns, climate changes, etc. disrupt habitats and cause new diseases to pass to animals, and rapidly growing human population result in more people living in close contact with wild and domestic animals, which provide more opportunities for diseases to pass between animals and people. And due to the explosion of international travel and trade, such diseases can spread quickly across borders and around the globe. Thus, existing or emerging zoonotic diseases can transform into a pandemic. So, this is the same thing what we have seen in the case of COVID-19. It originated in Wuhan, which is in China, and it spread to all of the continent in the world. So we are experiencing that, and now we'll discuss what are the potential outcomes from the One Health approach. So the outcomes are more interdisciplinary programs in education, training, research, and policy development will occur, and more information sharing related to disease detection, diagnosis, education, and research. And there will be more prevention of diseases, both infectious and chronic, and also there is development of new therapies and approaches to treatments. So that are the potential outcomes from the One Health approach. And guys, a word on National Mission on Biodiversity and Human Well-being, which was launched recently by the Government of India. And this mission aims to explore the neglected links between biodiversity and human well-being. It spans across the sectors of health, economic development, agriculture production, and livelihood generation. It addresses health and livelihood concerns along with efforts to mitigate climate change and related disasters. And one of the components of the mission explicitly links biodiversity to human health through One Health framework. So that's why it get mentioned in this lecture. And as a part of program, institutions are encouraged to set up surveillance systems at potential emerging infectious diseases hotspots across India. So it is an important mission, National Mission on Biodiversity and Human Well-being, and please study about that in detail. So that is it. That's about One Health approach. We'll meet tomorrow with another topic. Thank you for watching this lesson.